It's now official. Cholera has hit Nairobi.
We have confirmed cases in Kasarani, Makadara, in lunga area, and now we have this problem here.
So far, 9 people from Nairobi's Mukuru njenga slum have died following the outbreak.
We can confirm that 9 people have died from diarrhea and vomiting in the villages from reports that we get from community health workers and from the provincial administration.
Unconfirmed reports, however, say that 1 more person may have died last night. Health officials say that patients are not seeking medical attention early enough, as many of them succumb to the disease. Jacob Kimeo tells us that his uncle is one such patient. He had been in the house for 3 days without receiving any medical treatment.
Kuara kutapiga, akula chakula kidogo anatapiga. Around 3 days sasa.
And thus today the health workers had to go house to house looking for the patients. Meanwhile, at the Mary Mission Hospital, patients continued to stream in, complaining of severe stomach pains, diarrhea and vomiting. Doctors at the hospital have been administering oral rehydration salts and antibiotics to enable the patients to regain lost fluids and energy. The first cases were reported on Monday, but there has been a dramatic increase in the number of patients complaining of these symptoms.
We have an unusual increase in the number of cases of diarrhea and vomiting in Mukuru.
Medical staff at the Mission Hospital were overwhelmed and have been forced to postpone antenatal and tuberculosis clinics. In the face of the current severe water shortage, people, especially those living in informal settlements, are finding it hard to come by clean water for domestic use. Thus, residents in Mukuru njenga are finding temporary reprieve from what could well turn out to be polluted water sources.
Ilikuwa ikibeba mavi na hiyo mangari sasa wakapindua ikakuwa ya maji sasa.
This, it is feared, may have contributed to the spread, and residents of the area have been urged to exercise extra caution. However, it is clear that the battle against the disease may be far from over. Even though the local administration has been closing down eating spots in the area that compromise on hygiene standards, one of the safety measures to curb the spread of cholera, not many people seemed to have heeded to the new directive. Though residents have been cautioned to exercise high standards of hygiene to curb the spread, that may prove a challenge given the poor sanitation and lack of a proper drainage system. Sheila, Sendeyo, Citizen TV.